Hi, I'm Dr. Hobson, your health empowerment guide, and today's vlog will be concerning another nutritional supplement which is considered a non-essential nutrient because our body produces it with sunlight exposure, and that's vitamin D3. Now, in my 40 years of clinical practice, I am licensed to practice nutritional medicine because I was specifically trained in it and have had quite a bit of experience in finding essential and non-essential nutrients that are very therapeutic to the human body. Now, some people will need to supplement with vitamin D3 because of how they live, how old they are, where they live, and their extent of sun exposure, while others will not need as much supplementation because they live in sun belts of the world, living close to the equator, and they will get more sun exposure than others. So it's very important to our health to get around 600 to 800, at least 600 to 800 IUs of vitamin D3 daily. So sun exposure, if we get about 20% of our bodies exposed to the sun, our faces, hands, and arms, and we do that for 10 to 30 minutes a day, and we live in sun belt regions of our planet. And this exposure happens around midday when the sun is the most efficient, giving us the most UV rays. Our bodies will naturally produce the amounts of vitamin D3 that we need to be healthy. Now, folks who live in more northern hemisphere portions of the world they'll have to spend up to an hour and a half to 2 hours sometimes in the sun with 20% of their bodies exposed. And now in the winter months, both people who live in equatorial regions of the world and northern latitudes or far southern latitudes won't be getting near the sun exposure, and those are the individuals that probably would need to do some vitamin D3 supplementation. So vitamin D has a number of extremely important functions in the body to men and women. Women, because as women age into their 50s, you'll see in some of my other blogs, will have a high potential of developing osteoporosis. Vitamin D3 is essential to help calcium be absorbed in the body properly. And so preventing osteoporosis in both men and women, particularly women, is just very important. They're getting enough vitamin D3 in their bodies every day. So we know it supports bone health. We also know that it has some anti-carcinogenic properties. Very good research is showing that proper levels of D3 in your body prevents prostate cancer. It also helps prevent colorectal cancer and pancreatic cancers. We also know that vitamin D3 helps our minds and brains to work better. And there's some other natural benefits from sun exposure that helps release serotonin, helps us just feel better, helps our brains be more active and alive. We have to be careful with excessive sun exposure because that can lead to burning of the skin and the higher potential for skin cancers. So I've always recommended to our patients that want to get a little more sun exposure to be careful to not ever burn the skin, even pink, but get some sun exposure, 5, 10, 15 minutes, and not enough to get any kind of burns. If you do, you are running the risk for melanoma and basal cell carcinoma of the skin. So hopefully this information is helpful for our followers in knowing things they can and should do to protect their bodies, help their bodies work better, and keep their bones and brains strong. Until next time, this is Dr. Hobson. Thank you.